virus. It's break into the body and also the immune system, leaving the victim vulnerable to the host of life-threatening opportunity infections, neurological disorders, and addiction diagnosis. HIV is an antivirus. AIDS can be called modern pandemic, affecting both indigenous and developing countries. The AIDS Day observed in December 1st, more cases are reported in South Africa. Statistical will recognize the emerging disease only the early 1980s. AIDS has rapidly established throughout the world, likely to injure and in the 21st century. The number of new infections has fallen in 1.5 million in 2021. HIV was identified by Dr.
Give this mic, that's it. Wire.
Statistical report on AIDS were recognized as the emerging disease only early in 1980s. AIDS has rapidly established itself and throughout the world in 21st century. The number of new infections has fallen in 1.5 million in 2021. HIV was identified by Dr. Robert Gallo.
There are four categories. First category is initial infection.
virus and development of antibodies. Second category is asymptomatic carrier stage. Third category is AIDS-related complex. Fourth category is AIDS. Then signs and symptoms of AIDS. The main signs and symptoms: unexplained diarrhea, fatigue, malaise, fever, night sweat.
Thank you, Kirtika. Now I am going to invite the panelist Isaac for presenting the diagnosis and immunology of HIV and AIDS. Diagnosis of HIV infection, history collection, physical examination, screening test, serological test and ELISA test. History collection, we have to ask the patient of unnecessary sexual contact, any needle prick injury, or the mother had any maternal HIV infection, etc. On physical examination, we have to assess the patient health to food examination. Then screening test and ELISA test. ELISA test means enzyme-linked immunosorbent assay. This test is to assess the antigen-antibody reaction. If the clumping is present in this, the ELISA test is positive. Then we move on to the immunology. The immune system disorder associated with the HIV infection or AIDS are considered to occur primarily from the gradual depletion in specialized group of WBC cells. HIV selectively infect the T helper cells and other cells in the immune system such as B cells. Thank you, Isaac. Now I am going to invite the panelist Rashmi for presenting the mode of transmission.
We can see about the mode of transmission. Mainly, the disease affected humans in mainly three ways. The first one is sexual transmission, then the blood contact, and maternal-fetal transmission. First, we can see about the sexual transmission. AIDS are mainly transmitted by the sexual contact. We use any unprotected sexual contacts like using the unless we can using the condoms and etc. Or we can use any vaginal or oral sex can lead to this disease. Every single act of unprotected intercourse with an HIV infected person will expose the uninfected partner to the risk of infection. Next one is the blood contact. AIDS is also transmitted by the contaminated blood transfusion of whole blood cells, or we can use any unsterile method for blood transfusions, etc. Next one is the maternal-fetal transmission. That means the infected mother can also give the disease to the baby, and also if the breastfeeding will lead to the disease. 20 to 25% of total AIDS patients are affected by this method. So now we can till now we see about the mode of transmission. There are three methods there: sexual, blood contact, and maternal-fetal transmission. Thank you.
Thank you, Rashmi. Now I am going to invite the panelist Devi Priya for presenting the prevention of HIV and AIDS.
Prevention. Education. We are the nurses have the responsibility to educate the society about HIV virus and how to spread and how to prevent the HIV. Male and female condoms should be provided. Contraceptive methods should be provided during the sexual time or the intercoursing time. And needles and syringe program are highly associated with reduction in HIV. We are